How do new surgeries minimize invasiveness for cervical cancer? Imagine a surgery that can remove cancer with less pain, quicker recovery, and fewer risks. That's what new surgical techniques aim to do for cervical cancer. Instead of large cuts in the abdomen, doctors now often use minimally invasive methods like laparoscopy and robotic-assisted surgery. These techniques involve small incisions, usually just a few centimeters long, through which tiny cameras and specialized instruments are inserted. The surgeon views the operation on a monitor, guiding the instruments with precision. This approach means less tissue damage, less blood loss, and shorter hospital stays. Patients often recover faster and return to normal activities sooner. Another key advance is the use of sentinel lymph node biopsy. Instead of removing many lymph nodes, the surgeon targets only the first few nodes that are most likely to contain cancer. This reduces the risk of complications like lymphedema, which is swelling caused by lymph fluid buildup. It also helps preserve more of the patient's normal tissue and function. Recent modifications in surgical techniques also focus on avoiding tumor spread during surgery. For example, surgeons now often avoid using uterine manipulators or methods that might expose the abdominal cavity to cancer cells. These changes help lower the chance of cancer spreading during the procedure. For early-stage cervical cancer that is less aggressive, less radical surgeries like simple hysterectomy can be performed using minimally invasive methods. This involves removing only the uterus and cervix, without extensive removal of surrounding tissues, which further reduces invasiveness. However, it is important to remember that some high-quality studies, including the laparoscopic approach to cervical cancer trial, have shown that open surgery might sometimes offer better long-term cancer control for certain patients. This has led doctors to carefully consider the best approach for each individual, balancing the benefits of minimally invasive surgery with the need for effective cancer treatment. In summary, new surgeries for cervical cancer focus on reducing incision size and tissue trauma through laparoscopy and robotic techniques, using targeted lymph node removal, and modifying surgical methods to prevent tumor spread. These innovations aim to make treatment safer and easier to recover from, but always in a way that prioritizes the patient's safety and cancer control. If you or someone you know is considering surgery, it's essential to discuss all options with a healthcare professional to choose the most appropriate approach based on personal health and cancer stage.